Namaste. Welcome you all for the yoga session. In this session, we are going to use a chair, a mat, and a blanket. We are going to focus on an inverted posture similar to Sethu, Bandha, Sarvangasana using the chair. We shall begin with some basic postures. Lie on your back, resting the legs on the chair. Relax the complete back on the mat, chin towards the chest. Watch your breathing. As we inhale, the abdominal cavity should smoothly, gently expand, and as we exhale, it should contract. Watch even the posterior surface. Sensitize your back muscles to the breathing. Resting this way helps the complete lumbar region also to properly rest on the mat. And the venous return, that the impure blood from the leg flows down easily under gravity. Stretch both arms. Raise your right leg up, stretch the heel, pull the kneecap, tighten the top of the thigh, the quadriceps, toes towards the knee. As we inhale, the abdominal cavity should expand, as we exhale, it should contract. Legs straight. Relax your right leg, chain, left leg. Stretch the heel, pull the kneecap. This is a simple stretch for the thigh and the lower leg. Also helps the hip and the lower back. Watch your breathing. Left leg down, right leg. This is a simple stretch to tone the back of the thigh, the hamstring muscles, which have a great implication on the health of the lower back. Also helps the calf muscles. Release right leg, chain, left leg. You have to pull the kneecap, push the back of the knee. Feel the stretch in the back of the thigh, the hamstring muscles. Breathe consciously. Left leg down. Right leg up, fold, hold the knee, press the knee closer to the chest. Stretch the right heel, toes towards the knee. Tighten the hamstring muscle against the calf muscle and feel the knee capsule. Pull the knee closer to the chest. Feel the massaging effect of breathing. Release right leg, chain, left leg. Rise, fold, Hold the knee, pull the knee closer to the chest. Stretch the left heel, toes towards the knee. Watch your breathing. Feel the pressure of the left thigh on the abdomen and how breathing further helps to stretch the paraspinal muscles. Also watch the massaging effect of the breathing. Release left leg, right leg. Fold, hold the knee, press the knee closer to the chest. This posture is good for the gluteal minimus and medius muscles. Release right leg, chain. Left leg up, fold, hold the knee, press the knee to the chest. The gluteal minimus and medius muscles help in our walking, climbing, etc. And they also have an impact on the lower back. So all these postures help the hip, the lumbar region and the pelvic region. Good breathing is the essential foundation. Release left leg. Right leg up, fold. From left hand, hold the ankle joint, pull the heel closer to the root of the left thigh. Push the right knee. Breathe well. Do not allow the pelvic rim to rotate. As we inhale and exhale, feel the base of the spine. And tighten the hamstring muscles. Release right leg, chain. Left leg up, fold from right hand. Hold the ankle joint, pull the heel closer to the root of the thigh, and from left hand push the knee. This is a simple posture to gently mobilize the sacroiliac joint, that is the articulation between the spine and the hip. As we inhale, abdominal cavity should expand. As we exhale, it should contract. Release left leg. One more time, right leg up, fold from left hand, pull the heel closer to the root of the left thigh and then push the right knee. Tighten the inner corners of the right knee. For that you have to squeeze the hamstring against the calf muscle. Release right leg, chain, left leg, fold from right hand, take the heel to the root of the right thigh, from left hand push the knee, breathe consciously. As you inhale and exhale, you should also feel the paraspinal muscles, you should feel the abdominal muscles, you should also feel the pelvis and the hips. Release left leg. Slowly get up from the right side. Sit upright on the chair. Sit to your right side. Chest and navel up. Hold the top of the chair. Inhale, exhale, turn. Turn the neck also in the direction of the twist. Keep the shoulders even. Watch your breathing. As we inhale, the abdominal cavity should expand. As we exhale, it should contract. Twisting postures help to relieve the back muscles. It reduces the stiffness and it prepares the body for further movements. Watch your breathing. Good breathing also helps the abdominal muscles and organs. As we inhale, abdominal cavity should expand. As we exhale, it should contract. Slowly come up. Change side. Sit upright. Hold the top of the chair. Inhale, exhale, turn. Elbows closer to the trunk. Lift the trunk and navel up. Twist and breathe well. Watch your breathing. Slowly come up. One more time. Sit to your right side. Hold the top of the chair. Inhale, exhale, turn. Stretch the trunk up. Twist the trunk. So to retain all the curves of the spinal column and twist along its longitudinal axis. So don't lean to a side. And watch your breathing. Twistings rejuvenate the intestinal organs. Slowly come up. Change side. Sit to your left side. Hold the top of the chair. Inhale, exhale, turn. Feel the cervical spine, the thoracic spine and the lumbar spine. Be watchful, be present. slowly come up. Sit upright. Join the feet. Bend down from right hand. Lock the left knee and the foot of the chair. Left hand on top of the chair as far back as possible. Then twist. Turn the left shoulder as much as possible. You have to stretch the trunk diagonally, then twist. Feel the gluteal region, pelvis, the abdominal and the thoracic region. Turn the neck also. Release the grip, slowly come up. Sit upright, chain. Bend forward. Lock the right knee from left upper arm. Grip the foot of the chair from the left palm. Take the right hand up and back on the top rib of the chair and twist. Do not change the position of the hip. You have to be firm on the position of the hip and allow the trunk to twist. And do not hold the breath. Watch your breathing. Release the grip, slowly come up, sit upright. One more time, inhale, exhale, bend, grip the right knee and the foot of the chair from right hand, left hand up and back on the top rib of the chair, well open the left shoulder, well open the chest. Release the grip, slowly come up, chain, bend towards the left side, from left hand grip the right knee and the foot of the chair, right hand up and back, well open the chest, breathe well. So the twistings help to give better mobility for the lumbo-pelvic hip complex. So in what we are going to do, these twistings are going to make a better impact. Also twistings help to rejuvenate the abdominal pelvic cavity. Release the grip, slowly come up. Sit upright. Get up. Position the chair. Then sit upright. Chair to your front. Lie on your back. Adjust the position. properly. Stretch the legs, resting the ankle on top of the lower rib. Then gently lift the hip up. Shoulders grounded, hips up. Support the trunk from both the palm. Thumb coming out, rest of the fingers going in, legs straight. Chin towards the chest. Flex the knee, slowly come down. Gently move a little towards the chair. Rest the heel on the seat of the chair. Knees slightly flexed. Inhale, exhale. Rise the hips up. Support the trunk from the palm. And then straighten the legs. Well, open the chest. Chin towards the chest. Breathe well. Roll the thighs inward. Keep both legs straight. Stretch the toes towards the knee. Support the trunk properly. Take the elbows as close as possible. Keep the eyes closed. Relax your tongue, nose, throat and the jaws. Watch the junction of the throat. Watch your breathing. Feel the weight on the arms. You have to support it properly. Keep the legs straight. Note the position of the palms. Thumb outside, other fingers towards the spine. Elbows closer, shoulders firmly rested on the mat. Chin towards the chest. Watch the junction of the throat. You can keep the eyes closed. This is a relaxing posture. And as we inhale, the abdominal cavity should smoothly, gently expand, and as we exhale, it should contract. All these variants of Sethu, Bandha, Sarvangasana are very good for the thyroid and parathyroid glands, which have beneficial effect on the complete system. Release the arms, slowly descend, relax your back. Contract. One more time. Raise the hips up, support from the arms. Both legs straight, chin to the chest. Now rise your right leg up. Hold the kneecap, stretch the heel. When you rise the leg up, do not lose the height of the hips. Bring your right leg down, then chain, left leg up. Both legs straight. Watch your breathing. Watch the throat of the system. Slowly descend. So all these movements, so-called as the inverted postures, and especially with the chin lock, rather the shoulder stand, have a great impact Take the legs down, move further towards the chair. Take the hips as close. Then rest the legs on the chair. Breathe well. Flex the knee, raise the hips, support the trunk from the arms, press the foot on the seat of the chair. Take the elbows closer, shoulders on the mat, chin towards the chest, at the junction of the throat. Breathe well. Even here, as we inhale, abdominal cavity should expand. As we exhale, it should contract. Well, the pelvic cavity should also respond. The abdominopelvic cavity nicely responds to inhalation, exhalation. With inhalation, the abdominopelvic cavity expands. With exhalation, they contract. And there is a reverse force for the abdominal and pelvic organs by which they move down towards the diaphragm. And they all experience a nice massaging through breathing. Keep the neck at the center. Experience the good stretch for the muscles of the neck. It's also good for the shoulders. The shoulders also undergo extension while the neck undergoes flexion. So with the result, it gives a very good stretch for the muscles connecting the shoulder complex and the neck. Watch your breathing, stay in the posture, be connected with your breath, with your body, be present. So these type of movements greatly help many who have some problems related to the thyroid glands. You can see a good reversal of blood flow. So using props like chair, one can do these postures effectively, stay for longer time. In posture like Sarvangasana, one has to stay for a longer duration to get benefited. Slowly take out the arms, slowly descend, relax the complete back. Flex the knee, one more time, inhale, exhale, rise, support the trunk from the palms, then stretch both legs up, rest the ankle joint on the top rib of the chair, elbows closer, shoulders on the mat, chin towards the chest. Now you can see the gradient is further boosted, the venous returns from the legs improves, the impure blood coming down the veins improves because of the gradient. Gravity helps in mobilizing the flow from the lower extremities towards the heart. The pelvis and abdominal viscera, they move towards the chest. Thereby these organs also find a great relieving movement. And as you inhale, the abdominal pelvic cavity should expand. As you exhale, it should contract. Keep both legs straight, roll the thighs in. Keep the eyes closed, watch your breathing. Chin to the chest. So in this posture, the shoulder complex and the neck, they also get a good relieving movement. So these are very good in rejuvenating the thyroid and parathyroid glands. But one has to stay for some reasonable length of time. This is where these kind of chairs are of great help. As we inhale, abdominal and pelvic cavities smoothly, gently should expand. As we exhale, it should contract. Flex the knee, rest the foot on the chair, release the arms and slowly descend. Relax the complete trunk and the legs. Watch your breathing. One more time. Inhale, exhale, rise, keeping the foot on the chair. Now join the foot on the chair and drop the knees. Hold the trunk from the hands. Thumb out, fingers in towards the spine. This is Bandha Konasana. While you abduct the thighs, you get a better access for the region of the pelvis. So that is what you should observe in this, and make your breathing properly tuned to feel the expansion and contraction of the pelvic region also, along with the abdominal cavity. Chin towards the chest, elbows closer to one another. This is a very good inverted posture. It has great implications for the overall health of the body. The cardiac muscles are also helped by the change in the force field because of the inverted nature of the posture. Drop the knees as much as possible. Feel the base of the thigh. The shoulders, elbows, arms, wrist, they also get a good flexibility and strength in this posture. Watch the posture, watch the breath, be present. The mind is very dynamic in nature, so you have to be extremely attentive. Do not allow the mind to hop into the past or the future. Hold it in the present. Release the arms, slowly descend, resting the legs on the chair, trunks on the mat. Just watch your breathing. Relax the region of the throat and the neck. Watch your lower back, upper back, and the neck. One more time. Press the foot slowly. Rise the hips, hold, then stretch the legs on the seat of the chair. Chin towards the chest. So because of the stretch, now you can see a more pronounced longitudinal stretch of the pelvis. That is, along the midline of the body, the complete pelvis gets an enhanced stretch. Use your breathing to feel the pelvic cavity and the abdominal cavity. Watch your breathing. These are all variations of the so-called Sethu Bandha Sarvangasana. Variations of shoulder stands with the use of the props like chair. One can do a variety of these effectively, stay longer. Watch every breath. Now rise your right leg up. Pull the kneecap, stretch the heel. When you rise the leg, do not lose the height of the hips. Flex the right leg down, then chain. Flex the left knee and then extend the knee, stretching the left leg. Toes toward the knee, pull the kneecap, tighten the quadriceps. So these movements give you additional movement for the hip, In addition, you can get a better hold on the posture. Flex the left knee, stretch on top of the chair, then flex the knees, release the hands, rest the lower legs on the chair, relax the complete trunk on the mat. Just watch your breathing. Slowly get up from your right side. Keep the chair to your right side and orient it at an angle of 45 degrees. Sit in line with the leg of the chair, especially the one closer to the mat. Line your back, rise the legs and the hip up, turn the trunk, rest the foot on the chair, support the hips from the right hand, drop the left hand, then stretch both legs up, resting the ankles on the top rib of the chair. Shoulder well rested, neck at the center, do not tilt the neck, and breathe well. Support the trunk from right hand. Now you can see a nice twist for the trunk. So there is an inversion and there is also a twist of the trunk. So that would help the muscles and organs of the abdominal region, back, hip, pelvis, blood vessels, they all get a nice good twist so that they also improve. But you should adjust the position of the chair properly. Now flex the knee, rest the foot on the chair, take the support of the left hand, then slowly descend. So note the positions. You must adjust it properly to suit your configuration, that is height and length of the legs, etc. Slowly get up. Keep the chair to your left side and oriented at 45 degrees. Lie on your back. Note the position of the hip with respect to the chair. Take the hands down, rise the trunk and hip up, twist the trunk, keep the foot on the seat, then stretch the legs, resting the ankles on the top rib of the chair. Both legs straight. Do not turn the neck. Support the trunk from left hand, right hand free. Watch the nice twist right from the base of the shoulder joint all the way up. Then watch your breathing. It's very useful posture. It helps the complete pelvis, abdomen, all the major blood vessels. They get a nice twist. Flex the legs. Slowly descend. Relax your breathing. Slowly get up. Sit upright. Keep the chair in front. Take both arms back. Clasp the fingers. Open the face of the palm. Thumb moving down and then up. Then press the palm. We'll open the shoulders. This gives a good relief for the scapular complex and the shoulder joints, which have taken a lot of loading in the process of doing the Sethu Bandha variations. Slowly relax the arms. Keep a folded blanket on the seat of the chair. Sit upright. Stretch the trunk. Slowly bend forward. Rest the forehead on the blanket. Arms relaxed on the chair. Neck relaxed. Eyes gently closed. Do not hold the breath. Slow inhalation, slow exhalation. No pressure on the eyes. You should rest the forehead. Relax the arms. Supported forward bend. And watch your breathing. So this is a very good relaxation after the inverted posture. This kind of a supported forward bend helps one to relax better, and you can feel a deeper sense of relaxation. Be aware of your breathing. Be aware of the complete spinal column. Slowly come up. Sit on top of the blanket, hips on the blanket, legs on the mat. Sit upright. Both palms should face upwards, tip of the thumb and index finger in contact. Chest and navel up. Relax your tongue, nose, throat and the jaws. Have complete musculoskeletal awareness. Now you are going to do the following. First, you should do complete breath. That is, as we inhale, the bottom of the abdomen, middle of the abdomen, top of the abdomen, then bottom of the chest, middle of the chest, top of the chest should expand. Then simply relax, chest contracts, abdominal region contracts, and exhalation happens effortlessly. Make it slow and steady. First practice this. Then we are going to do the Ujjayi pranayama. You have to follow the same pattern. You have to keep the chest and navel up. and keep doing the complete breath, where you are going to use the pelvis, abdomen and chest. That is, as you inhale, the pelvis, the bottom of the abdomen, middle, top of the abdomen, then bottom of the chest, middle of the chest, top of the chest should expand. Then simply relax, chest contracts, abdominal pelvic cavity also contracts, air comes out. And you should try to make exhalation longer than inhalation. This is what we should remember. Then in Ujjayi, we are going to do the Jalandhara Bandha or the chin lock. You have to take the chin to the chest, but ensure that the chest does not cave in. You should keep the chest up and then take the chin towards the chest. Then contract the air tube slightly and then do slow, steady, complete inhalation, slow, steady, complete exhalation. As exhale, chin to the chest. Then contract the air tube. Slowly inhale, slowly exhale. Feel the distinct sound of inhalation and exhalation. There will be a distinct sound of the incoming air and the outgoing air. Just watch that. A very mild sound, soft sound, not too harsh, not too loud. Do the complete breath. The Ujjayi pranayama is also called the victorious breath. It helps to lift our moods. It helps our circular respiratory response. The lungs expand. The diaphragm gets into a full range of movement. The cardiac region also gets nicely massaged. And the chin lock also helps the thyroid and parathyroid glands. Be seated upright. Watch your breathing. You are doing Ujjayi pranayama. There is the chin lock. And you should also know that the postures that we did, they help a long way in executing the chin lock or Jalandhara Bandha properly. You should do the chin lock without straining the jaws. The chin lock should happen more as a flexion of the neck. Ideally, chin should touch the chest. Initially, try to at least take it towards the chest. And in this you have to adopt complete breath. That is, during inhalation, exhalation, we should use all the three cavities, namely the pelvic cavity, abdominal cavity and chest cavity. A complete breath with Ujjayi Also helps the lungs. Lungs are referred to as the powerhouse of our system. And the breathing should be smooth and even. The duration from cycle to cycle should not greatly vary. There should be no jerky movements. Be watchful. And when you do it gently and smoothly, the Ujjayi pranayama also helps one to completely relax. The mind also calms down. So you should have the awareness of the posture of the breath. For that you should keep your mind completely focused. Mind should be in the present. And the pleasantness automatically comes. Slowly raise the head up. Just be relaxed. So this complete sequence is a great help to the thyroid and parathyroid glands, which have a very great implication on the health of our system. Namaste.